My name is Ryan Handoko. I'm the pediatrics resident at the Johns Hopkins Children's Center, and I'm presenting on pre-existing chronic illness as a risk factor for pediatric COVID-19 disease severity, which will be presented at the Pediatric Academic Societies meeting. This has been work that I've been doing with Dr. Olga Charnaya, and we've been looking at children who have been hospitalized with COVID-19, and among those who have a particularly severe hospitalization course. Now, not many children have to be hospitalized when they get COVID, but some of them do. And of those, some of them unfortunately have a rather bad hospitalization course. And we're interested in trying to see whether we can figure out what are the commonalities between children who have to be hospitalized and children who have a really bad hospitalization course, those who require extra oxygen support and may have to be intubated or may have to receive intensive medical care. So we've taken a look at the data across Johns Hopkins institutions, and we've been able to identify some patterns. Some children who have to be hospitalized, they tend to be more likely to have chronic disease, and in particular, we've identified which chronic diseases tend to be higher risk factors for severe COVID, and these can be chronic GI or gastrointestinal disease, chronic lung disease, congenital anomalies or genetic conditions, cardiovascular disease or congenital heart disease. Younger children in our study seem to have a higher risk of developing severe COVID. More common conditions like asthma or obesity have been people have been very interested in taking a look at whether those sort of common conditions are also risk factors for COVID. And in our study, they weren't, which is helpful to contribute to the literature. And some data has suggested that asthma and obesity might be risk factors, some haven't. And so having another set of data to contribute to answering this question can help move the field forward. And in the end, we just want to be able to help recognize what are the commonalities, what are the risk factors that some children might have if they do contract COVID, and whether they have risk of being hospitalized or have to have a severe hospitalization. I'd like to thank Dr. Olga Charnaya, who's been my wonderful mentor in the Department of Pediatric Nephrology. And we also have some fantastic collaborators in Dr. Teresa Chang, Dr. Six Samuels, Dr. Doug Mogul, Dr. Dori Segev, and Dr. Jacqueline Goranczyk Wang.